Welcome to the Vet Med Wellness and Leadership Podcast, where we discuss central challenges vet med leaders face, such as burnout, stress, and difficult interactions with clients and staff, just to name a few. In each episode, you will hear about actionable solutions that you can apply to your practice and invitations to connect with fellow leaders who are passionate about improving the wellness of the vet med profession. By subscribing, liking, commenting, or sharing this podcast, you are helping more veterinary professionals find the resources shared in these episodes. Thank you in advance for listening and supporting this show. I hope you enjoy it. All right. Hey, everyone. Crystal here. And joining me today is Dr. Bob Lester, Chief Medical Officer of Wellhaven Pet Health, a former practice owner and founding member of Banfield Pet Hospital and the Lincoln Memorial University College of Veterinary Medicine. He also serves on the board of Pet Peace of Mind, Wellhaven Pet Health, and the Lincoln Memorial Veterinary College. Today, we're talking about the veterinary workforce crisis and what to do about it. So whether you're a practice owner, manager, or employee, the veterinary shortage likely greatly impacts your emotional and physical well-being. So let's dig in and talk about the workforce crisis and what we're going to do about it. So Dr. Bob Lester, thank you so much for being on with us today.
Well, thank you for having me, Crystal. Always enjoy talking with you.
Same here. I was hoping we could start today with painting the picture of what's really happening with the workforce crisis, maybe giving some data or statistics to really help people that may not be fully informed about the current crisis and what's happening.
Sure, happy to. So first of all, as an optimist by choice, let's recognize that this is a problem of abundance, that pet numbers are up, pet spending is up, pet lifespans are up, euthanasia is down. The bond between pets and families has never been stronger. That's all reason to celebrate. And it's all resulted in too much business, which is a problem, but it's a whole lot better problem than having not enough business. I think that's evidenced by any of us that are in the veterinary profession, just trying to get an appointment, trying to get in to see, God forbid you have an emergency, to get into an e-clinic. It's gotten really tough out there. The data behind that, we're seeing more and more. Dr. Jim Lloyd, the past dean at the University of Florida, who's, in addition to being a veterinarian, is also a PhD economist, is now at Animal Health Economics, and he's done some really interesting research and writing on the topic of late. And in short, it comes down that when you look at the number of veterinarians that are retiring, when you look at the number of new grads that are coming in, and we look at the increasing demand, his projections would indicate that we'll be down about 15,000 companion animal veterinarians by 2030, which is about a 16% shortfall. So we have a shortage now, and it's likely going to get worse before it gets better. What that translates into a number of pets helped, if you go by that data, about 75 million pets will not be getting the care they need by just 2030. And we already know that pets aren't getting the care they need today as a result of the shortage.
Wow. How did we get to this point? Do you have an idea of where this started? What's the history on this?
I think there's two or three things that have gone into it. First and foremost is just the humanization of pets. You and I as pet parents know how in our lifetime, pets have become more and more important to society and to Americans' homes. That number of pets are up, the bond is up, the care we give our pets are up. They truly have moved from the barnyard to the backyard to the bedroom. They are four-legged family members now. So that's a huge influencer on this. Additionally, we went about 35 years without opening a veterinary school. So there was quite a drought there in turning out additional veterinary professionals or veterinarians. And I think lastly, there's been a generational shift where my generation of boomers, right or wrong, we were okay with 55, 60-hour weeks. Subsequent generations, in my view, are a whole lot smarter. They're more interested in 35 or 40 hours a week. They get it, and they put life before work, where many of my generation put work before life. So we've got a combination of things coming together that's resulted in the shortage we're dealing with today.
Mm-hmm. I'm curious how you think the levels of turnover are impacting this. I was just, browsing online at some of the stats, like with the AVMA, one of the papers they put out, noting that the turnover levels for veterinarians being twice as high as that for physicians, and then veterinary technicians having one of the highest turnover levels of all healthcare positions. Do you think that's a factor?
Oh, without a doubt, and particularly with veterinary technicians, in that they are oftentimes, I think, and I don't have great data to support this, but with the shortage of veterinarians, we often see what I think of as just moving the same pieces around the chessboard. So we may leave a veterinarian, but they go across town, or we gain a veterinarian, but it was one that was working across town. So we're not getting a net influx. We're just moving people around. With vet tech, sadly, they're more often than not leaving the profession. Some of the literature would indicate that the average career span of a vet tech is only about 7 years. So while there's 33 veterinary schools, there's over 200 vet tech schools. So we potentially can turn out enough vet techs, but until we retain them, and we've got to treat them right, compensate them, use them to the top of their license, the retention issue with vet techs is particularly acute.
I experience that all the time in the work that I do. I'm directly working with veterinary technicians often lead roles. And it naturally comes up because the space I provide is a confidential space that they're considering leaving vet med. And one of the reasons they cite is often compensation. They say, oh, if I went and became a radiology technician, I could make twice the amount. And they're willing to put in the school and the education and the time off to get there. And so it's really, to have some difficult conversations about what these people really need in order to keep them in the veterinary field. And I know compensation is only one aspect of it.
Yeah, other aspects that veterinarians have done a poor job historically in really utilizing vet techs to the top of their license. We've been slow to delegate, to embrace a team-based health delivery model that all the other health professions have done. And we've not built a career ladder. For vet techs, typically it's a 2-year associate degree, and that's it. Unlike humans, where there's an associate degree nurse, there's a 4-year nurse, there's master's level, there's even PhD. We've not built a nice career ladder, and we can, and there is work underway to build just that.
That's exciting. I'm sure we're going to get into that today with some of the ways we're going to resolve this issue. I wanted to also ask, just while we're painting this picture, what are some of the implications if we don't address the shortage? If we just say, oh, we're going to let it continue to go on this trajectory, I'm thinking implications for staff, implications for patients and clients.
Yeah, and they can be pretty dire, and we're already seeing some of those implications. And again, on the optimistic side, there are steps underway to resolve them, or at least mitigate them. From a staff point of view, well, veterinarians in particular, about 20% of veterinarians surveyed for years now have said they want to work fewer hours. So even before the current crisis was identified, veterinarians have wanted to step back. They're even willing to take less pay. And should we keep pushing our veterinarians as well as our techs and the rest of our team, we are seeing increased incidents of burnout, compassion fatigue, mental health issues, people leaving the profession, and God forbid, suicide, the things that thankfully people like you are in the profession to help us deal with. So there are real downstream implications of this shortage on our staff. On our patients, it's pretty clear too, that pets aren't going to get the care they need. Your baby right there in front of you. If you can't get your baby in for a week or 10 days to see the vet, that's not good. Care delayed or denied. Shelters in particular are struggling now to keep veterinarians and veterinary professionals. We run the risk of non-veterinarians filling the gap and perhaps not giving good advice. We're seeing weekends closed at practices, evening hours closed down. So the barriers to care keep going up and up and up, and pets will suffer as a result. And certainly clients, ultimately, wouldn't it be a shame if clients are reluctant to get pets because they fear they can't get in to see a veterinarian, or the risk to two-legged animals' health? You and I are well aware of the benefits of what you're doing right now, petting your kitty. That's so good for you, for your emotional well-being, walking your dogs for your physical well-being, your blood pressure, all the things that we know pets do for human health. That's at risk if we're not there taking care of those pets. And perhaps lastly, just the public health consequences. I think it's sometimes overlooked by clients that one of the roles of veterinarians in public health is to guard you and I from zoonotic, from diseases that go from pets to people. So things like rabies and leptospirosis and common parasites that veterinarians are the front line on. So there's a number of risks of not addressing the workforce shortage.
Such good points. And I think that bringing in that part of our public health, both from a physical standpoint and emotionally, is really key, and such a it's a pervasive factor. People let this get out of hand. But I think the point of our conversation today, too, like you started the top with today, you're an optimist by choice. And I really appreciated when we had originally met and reading more of your articles and understanding more of your perspective, that you have a very robust way of looking at this and bringing together multiple factors that are all synergistic in how we can address this. And it's actually doable. We're at a perfect point in time where we can start making a difference. And I would love to talk about some of the solutions that you have envisioned.
Yeah, I see a half a dozen things we can do, and they're not ors. And too often I hear colleagues talking about we can do this or this. I think it has to be an and. And amongst the ands, and maybe I'll just touch on each one real quick, Crystal, and then we can go a little deeper on each. I think one is just back to well-being, why you're in our profession, why you do what you do, is we've got to take care of the people we have today. We've got to help them understand they have to take care of themselves first, then their team, then we can take care of clients. And that's not intuitive to most veterinary professionals. Second, clearly we need more vets and vet techs, more vet schools, more seats in schools, 2 cohorts a year in schools. On the vet tech side, it's not so much we need more seats as we need to keep the ones we have. To some of the reasons we talked about, if we could talk further. I think the third and would be around technology, and that includes so many things from clinical decision support to diagnostics utilizing artificial intelligence to telemed. There's so much we can do with telehealth. We've barely scratched the surface. The other and would be team-based healthcare. We talked about that earlier. It doesn't have to be one veterinarian in one exam room with one client and patient. We can build a team and provide better outcomes, make clients happier, help more pets, and maybe even get home on time. The other and this one seems obvious, but I don't hear it often mentioned, is preventive care. Our profession, much like human medicine, is largely reactive. Imagine if every pet out there, we were getting out in front of nutrition issues and behavior issues and immunizations and parasites and dental health. So much of what clients are clamoring to see their veterinary professionals today could have been prevented with just a good preventive care plan. And the last of my ands would be being open to new models of vet care. There's so many cool things popping up now. It doesn't have to be the old model, the old bricks and mortar, one vet, one exam room, the telephone, the paper records. There's urgent care models filling a niche. There's dental care models filling a niche. There's vet tech delivery models. There's wellness models. There's technology telemed models. There's so many cool things that are popping up out there. When we start looking at tackling each of these and, I think we can make a significant difference. So while it's depressing to look at some of the data, and on the one hand, it's good, the growth we predict to see in this profession between now and 2030, the number of new pets, them living longer, that's all great. However, unless we solve this solution, we're going to put more and more stress on veterinary professionals. And between these ands, I think we can make a significant dent.
Ooh, I like all of these. Let's just dive in. Let's start with wellness, since I'm cracking my knuckles. Just one of my favorite areas. I very much come from a framework. As a psychotherapist, we start with Maslow's hierarchy of needs. You have this little pyramid of what a human needs to function, and we think about that in terms of veterinary professionals. You take an animal and you say, what are the basic things it needs just to survive, and then what does it need to thrive? And the same thing for humans. We have this basic need of wellness that's just central to our functioning, and you build everything on top of that. And I thought that was something you and I really clicked on. And also with Wellhaven, that your model is really built on having this, staff of people that are healthy and well. So I'd love to hear more about your perspective on that.
And I think it's interesting. And in some ways, it's kind of flat forehead obvious. On the other, I don't think it is to veterinary professionals. And if you sum it up, it's kind of putting vets before pets or veterinary professionals before pets. I think as a profession, it's noble, it's wonderful, it's why we're all here, but we tend to put others' needs before our own. And that's just not sustainable. So just really believing and coaching and leading by letting people know, first take care of yourself, then you can take care of your team, then take care of pets and families. And that all makes sense intellectually. But in today's day, with the workforce shortage, when you're telling clients, I can't see you today, it's really, really hard. So we've got to put vets and veterinary professionals before pets. And that is not intuitive to most veterinary professionals. That's not why they're here. but we have to do it. We're burning out too many people.
So I will say, just from being on the front lines of this, well, I'm a reformed, veterinary technician, came from the same background of, you always serve everybody first, right? You're very dutiful, very responsible, high degree of empathy. And that's what really is the decision-making device inside of our minds. And I remember going through school to become a psychotherapist. And I think therapists are wired a lot like veterinary professionals, very empathic. We love to reduce suffering. We love science. So there's this similar mindset. And a big part of our curriculum was trying to teach us the necessity of self-care. Otherwise, as a therapist, you can't make it. When you're exposed to grief and trauma and suicide and depression over and over, you have to have a way of processing it and having your own self-care practice. So part of our curriculum was actually building our own self-care practice and our oxygen mask on first. And I remember how difficult it was to actually do it. You think, I don't need this. I'm just going to get in there and do the work. And then you start feeling the exhaustion set in. Like, oh gosh, maybe I should practice some of these tools that we talked about in school. And I noticed in working with veterinary professionals, there's a fear around letting go and setting the boundary and saying, I'm going to put my needs first. There's a fear of repercussion from the client. And that may just be an imaginary one. It may actually happen. There may be pushback. I think from a company perspective, some company cultures may not support that. And when I've looked at the organizations that really embrace this in a way that's inspiring, I think it comes from the top down, where you have leadership. They're walking the talk. They're the ones role modeling it, and that helps give everybody else permission to do it too. I'm wondering what you see in terms of wellness, what actually rubber meets the road works. How do we get
it multifactorial, like so many things. I wish there wasn't an easy silver bullet, but it's so many things. And I do believe it starts at the top, and it's walking the walk. You have to build a safe working environment, and you have to back that up, that it's okay to ask for help. A very timely example, I was just on the phone before you and I connected with one of our doctors that leads a great Seattle area hospital. She's got a wonderful 4-doctor hospital. She's been there for decades. She provides great care. She has 2 doctors that are leaving. One's spouse was transferred, and one is moving closer to their parents. So suddenly her 4-doctor hospital is going to go to 2 while we work to get her new doctors. And she's crying because she's talking about, I can't help the pets that need to be helped. I can't maintain the hours that I need to be there. I've got to keep my team full. And she's taking all this on herself. And I think that's typical of our profession. So our conversation was, let's get relief doctors. Let's close back hours if we have to. Let's reduce whatever we need to do. Take care of yourself and your remaining doctors and team. We'll get through this, but you can't just power through. And I think for decades, our mindset was just cancel your vacation, skip your weekends, ignore your family, and power through it. Pets and families need us. And by golly, that's what we're here for. We can't keep doing that. And we've got to live that. It's got to come from the top. We've got to model it. We've got to embrace it. We've got to build a safe place that it's okay to ask for help, and then have the resources or know where to point them to get that help.
Fabulous. Yeah, and there's so many resources out there now. It's really growing. There's an abundance of online resources that we can go to. You can Google like Wellness and Vet Med and NAMV and all these different organizations that are there to really provide support. So if you want to build this into your culture, it's all out there. We have great examples that exist.
One of my learnings the last few years, I naively assumed this was a generational thing as a boomer, that, well, as old people grew up knowing not to ask for help, but younger folks are so much more, they're smarter, they're more enlightened. I spent time, as you mentioned in the intro, as an assistant dean at a veterinary school, and was really surprised to see it was no different, that Gen Zs are just as reluctant to ask for help as a boomer. So and this is your space, but I was surprised to see that it's across all age groups.
Oh, yeah. It's very hard to ask for help because it goes back to like Brene Brown and vulnerability. It's very vulnerable to admit that I'm experiencing a really challenging time and I'm not sure how to navigate it. I think our culture too in the United States is very achievement driven and presenting this performance-based persona. And that means we get the job done. We pull ourselves up by the bootstraps. We're built on that here.
Yep.
And so to soften a bit and to look at the reality, just to be accurate and say, I'm going to be accurate here. this is not sustainable. And I think if we can have a mindset that's more centered around accuracy and sustainability and longevity, and I always take an existential point of view that we're only here for a short period of time and it should mean something. And what brings meaning in life it's a multifaceted life. We want to have meaningful work, meaningful family life, meaningful spiritual and self practice. And I think that we kind of lose perspective of that and get very focused on just the work. And again, our culture is very driven for that. But we have to step back from it and say, is that really the Kool-Aid that I want to drink and subscribe to fully?
And perhaps even exaggerated when you look at healthcare professionals or professionals in general. We're selecting for the type A's that always had to be at the top of the curve, that we have to solve it on our own, that we have to be that step apart, that you could never be satisfied with a B minus. You've got to be at the top. So it seems it's an issue across society, but in my view, perhaps it's even more focused in when you start looking at a population of professionals.
I think you're so right. Yeah, that's a really good point. Mm-hmm. Well, so let's go on to the next point. How about we have 6 different points we're talking on today. Do you have one that follows nicely from wellness you want to build on?
Sure. Well, then the next and would be, because any one of these alone is not going to be enough. So beyond taking care of ourselves and well-being, the other one, it, again, seems fairly obvious. We need more vets. We need more vet techs. So in the case of veterinarians, we need more seats in vet schools. We need more vet schools. We need second cohorts. Lincoln Memorial University just went to a second class. LSU is about to increase class size. We've had a couple of new vet schools open the last few years. So to solve the workforce shortage and supply-demand imbalance, we need to come up with a supply of more providers. Again, in the case of vet techs, to reiterate, in vet techs with over 200 vet tech schools, it's not so much a matter of more seats as we just got to take care of the ones we have. And we can talk about that as we talk about team-based healthcare as one of the other ands in this workforce solution model.
Great. When it comes to graduating more techs as well, are there schools that are coming out with like hybrid approaches that may help move people through a program more quickly? I know the traditional route is 4 years to graduation, then additional years if you want to specialize, similar to med school for human medicine. Are there any models like that speed up the process?
Yeah, a couple of thoughts. On the veterinary graduate side, one of the new veterinary schools that just opened, the University of Arizona, has a 3-year program. So most veterinary schools will go in 4 years, and between your first and second and third year, you'll take your summer off. What University of Arizona has done is they've accelerated the program by going straight through, which makes a lot of sense. 1, we can get more veterinary graduates out sooner. 2, their debt goes down. 3, they're in the workforce getting a paycheck sooner than others. So there's a lot to be said for the 3-year model. It's been tried in the past, 20, 30 years ago beyond that, I think when University of Tennessee and perhaps others initially were 3-year models, they later went to 4. University of Arizona is back to 3. And there are a couple of other new schools that are still in the talking stages that may go to 3. Mm-hmm. On the VAC Tech side, there's some really nice programs out there that can be done largely online, which doesn't necessarily accelerate it, but it can take people that are out in the workplace today and help them get that associate degree, get the credentials that they need to truly be called a veterinary technician while working.
Yeah,
so there are other things happening.
Mm-hmm. Great. And so I'm thinking about linking these together, wellness and then graduating more veterinarians and technicians. I really appreciate how there's more and more of an emphasis within vet schools on wellness. Like I was meeting with one of the members at UC Davis talking about their program and how they work with the 4th-year students and really getting ready from a wellness standpoint of that first year in vet med can be so challenging.
Yes.
You have a lot of imposter syndrome and perfectionism and lack of confidence. It's just inherent with being new in any profession, especially veterinary medicine where the stakes are high and you're dealing with life and death. So it's really reassuring to me to see that we're starting to build this more into the curriculum.
Yeah, it really is nice. I was fortunate a number of years ago to be on what's called the Council on Education. So that's the group that is in charge of accrediting veterinary schools. So I was what was called a member of a group of people called site visitors, where we go on site to make sure those schools uphold all the standards needed to be continually accredited. And virtually every school has some type of counselors out there for students. But funny story, or funny to me at any rate, I was at one of the universities for several days doing a site visit, talking to the counselor there, and was surprised to learn that their time was split about 50-50 between working with students and working with faculty. Again, it hadn't occurred to me. The faculty has all the same stresses, and they took advantage of the counseling services as well.
That's so wonderful. I love that. I've had a similar experience. I've been brought into hospitals. It's usually for certain members of the team that are struggling. And then before I know it, I have many other people knocking on my door like, can I just come in and have a moment? You're like, absolutely, because we're all human and we all need a space where we can kind of decompress and work through things.
Yes.
That's lovely. Okay, so on graduating more veterinarians and veterinary staff, anything else you want to say on that topic?
I think that one's fairly straightforward, and that alone won't meet the need. But again, the power of the ands. The next and, in my mind, would be looking at technology. Again, we have a wonderful legacy, historic James Herriot kind of model, but it's starting to break down, and we've got to embrace technology. We've got to look at the millennial pet parent, the new generations, and what they're looking for. And technology includes so many things, but virtually all cases, they better support the veterinary professionals with connecting with the client and the pet. So whether that's an app, whether that's a cloud-based practice management system, whether that's artificial intelligence in your diagnostics, there's so many different pieces that are coming to bear. And perhaps the most promising, or one of the most promising, is the idea of telehealth and telemedicine, which in human healthcare, particularly post-COVID, is everywhere and acceptable. Talking to friends that are physicians, it wasn't acceptable a couple of decades ago. It was pretty scary to physicians. There was a lot of pushback, and that's kind of where we are in the veterinary world now. To some of us, this seems a clear, partial solution, and clearly doesn't do everything, but it has the potential to do so much to help alleviate the workforce shortage, help more pets, break down barriers to care. But there's some fear out there, I think unwarranted, but we're moving in that direction. So well-being and more vets and vet techs and embracing technology, just one more pillar as we look to put a dent in the workforce crisis.
Can you speak to what those concerns are around telehealth or telemedicine?
I think there's a couple. One I fear is just a scarcity mentality, that there are those that fear this is going to take business from me. And I kind of get that. If you spend 20 or 30 years building your practice and you're afraid somebody on a telephone or on a Zoom link is going to take your business. But to me, the reality is the pie is enormous. We're coming nowhere near and touching the pets out there, getting the care to the ones that we see, all the care they need outside of the ones that we're not even seeing today. So there's so much more that we could do. The other fear gets kind of in the weeds, but there's a lot of talk about the VCPR, the veterinary client-patient relationship. Many state practice acts require for a veterinarian to establish a veterinary client-patient relationship, you have to have hands-on on that pet. And at first blush, that kind of makes sense, that this pet can't talk, you need to be right in front of it, you need to touch it. However, there's a lot you can do. Look at what's going on in human medicine. Look what goes on with pediatricians. Look what can go on between pets and clients through a virtual means. Veterinarians have been on the phone for generations talking about things, making recommendations. So the move I see happening, and it's going to take a while to get past some of the fear out there, is towards what's called a virtual VCPR, that a veterinarian could establish that relationship through a virtual modality. I think ultimately it comes down to trust. We have to trust veterinary professionals to be able to make that decision, and we trust veterinary professionals to make diagnoses, prognoses, deal with scheduled drugs every day. Why can't we trust them either through the phone or through a virtual link to determine, yes, this pet, I can help without seeing it, or no, I can't. That pet needs to come in and somebody needs to lay hands on it. We will get there. It took physicians a decade to get there. Hopefully it won't take us a decade, but we're on the way.
Yeah, there's been an interesting pattern I've seen with veterinary medicine, which is we're slow to adopt things that are already working in other sectors of human medicine. So, for instance, having a variety of online resources prepare for your licensing exam before it's like, sorry, you're on your own, buddy. And then someone's like, hey, you know what? Human doctors have this. Why don't we? That would be nice. Yeah. Or companies coming out like the dental model that basically has all of the operational components of a business taken care of for a fee, not for ownership, not for equity, just for a fee. So you can say, as a veterinary professional, I want to just do medicine. I want to outsource all the other things. That's just up and coming. It's barely budding. But I think that it's funny how we're kind of riding the coattails slowly. We're slow to adopt these new habits. And I understand the fear. I mean, something I always use with clients when they're afraid of change is to say, you can always go back to the old way. You can try telehealth, and if it's terrible, we can ban telehealth and say, no, it was a disaster. But why not give it a try? And I think, too, from I'm at that age where I think I'm kind of bridging the gap. I can kind of go one way or the other in terms of, how I land on various topics. But I noticed with technology, even being a receiver of it as a patient, how much easier it's made my life to be able to contact a doctor through electronic means, and also the quality of life that it offers. You were mentioning earlier how, this newer generation of doctors, they want quality of life. They want to work fewer hours. They may want to have a multifaceted life of raising kids and traveling. And so for a person that really is eager to have that type of life, then having more of a virtual option may be great. That's why some people choose relief work also, so they can work when they want to. So it does seem like it may also attract more people back to vet med or keep them in vet med if they could have more flexibility.
Yeah, completely agree. And kind of the curse of innovating is some things are going to fail, and that's okay. We just keep trying. And like you, I've often said, and I think it's been true, that the veterinary profession is slow to change. However, coming out of COVID, again, reason for optimism, we turned on a dime. We turned our model upside down as an essential provider of healthcare out there. We stayed open. We got things done with some bizarre handcuffs, but we made it happen. So we proved we can change. So hopefully let's keep that up.
Yes. Would it be nice if we could take some of the things from COVID that actually worked well and keep them going? Like, that type of technology was actually really helpful. Let's just keep using it.
In fact, and perhaps not as optimistic, the VCPR is a good example. In a number of states, a virtual VCPR was allowed as an emergency during COVID. And the hope had been, because there's been virtually no pushback, no adverse events, zero out there. The hope was that would continue post-COVID. Sadly, a number of states have started to roll that back, that they're getting rid of the virtual VCPR, going back to the hands-on VCPR, but not everywhere. So we will gradually make change. That the old joke is, change is made one funeral at a time. We're on the way.
The Galaxy Vets Foundation, they were offering support to veterinary staff and pet parents in Ukraine. And they had to overcome some similar barriers. I'd be curious to see if they were collecting any data on how well this is working, or we have people here in the United States providing veterinary support through their vet techs as well as doctors. That would be interesting to see if they're documenting.
And in fact, there is some really good data out there. Probably the best comes out of the province of Ontario, where they embraced a virtual VCPR a number of years ago. In Ontario, Toronto's enormous. There are tens of millions of people that live there. I recently heard the director of their equivalent of their state board, their provincial governing body, they have again had zero adverse outcomes after years of having had a virtual VCPR. And of course, untold numbers of testimonials of people that got help that might not have otherwise.
Yes. So that's so interesting. And it goes back to what we were saying earlier about the archetype of people that are attracted to veterinary medicine. If anything, they're hyper-vigilant. They're overly cautious. So if they're like, I don't think I can, if I'm not certain that I can really help this animal without having hands on it, I'm going to refer it out because I don't want that on my conscience that the wrong thing. And the statistics are very interesting. So that could be a nice argument moving forward. I love the vision of it because I know as a pet parent of 3 cats, I could definitely use the support to just be able to contact somebody virtually. That would give me a lot of peace of mind. So I really like your third and. I like how they're building. Let's keep going.
Well, then the next one would be one that I could go on and on and on, and that's just the value of team-based healthcare. Again, veterinarians tend to be, and I've always called it the John Wayne syndrome. It's the fierce individualist. One doctor, and historically that was male, walks into the exam room or on the farm or at the stable, and we take care of it. We do it all from from counting pills to charting notes to you just do it all. And that's the history we come from. And that's not a bad thing. Those are great shoulders to stand upon, but that's not the day we're in today. And when you look at every other healthcare professional, they've embraced team care delivery. Physicians have 4 or 5 empowered, credentialed people around them. Dentists have 2 or 3. Veterinarians have 1. A vet tech, and the ratio is about 1-to-1. A vet for a vet tech. That's not the way to build a team. So veterinarians, first of all, have to get out of their own way and delegate and trust and empower. We've got to be using vet techs and VTSs to the top of their license. We're not today. And sadly, this is another case where I think some colleagues have positioned this as an or, that you can be for empowering veterinary technicians, or you can be for this idea of a nurse practitioner. Why can't we be and? We make a huge emphasis in our practice of empowering vet techs. We've got a number of tactics out there. We're driving on it every day. It's the best for our teams. It's the best for medical outcomes. It just makes so much sense. And why can't we be thinking about what might the future look like with the equivalent of a nurse practitioner in the veterinary world? And again, good news, the first program is out there with students in it. There are several more schools that are looking at programs like this. And it will take a few years. We've still got to develop the credentialing. We've got to go through the state boards. But when you look at the history of where nurse practitioners and physicians' assistants came from, as the story's been related to me, it started with academia seeing a gap, starting to provide that education. Then came credentialing, then came recognition. And again, physicians were slow to adopt this as well several generations ago. But now, imagine not having nurse practitioners and physicians' assistants and similar. We can do the same in the vet world. And additionally, not only to help give us more capacity to help more pets, but imagine that's one more rung in the career ladder for vet techs. So there's so many advantages to going in this direction. Again, there's a lot of fear out there. It's going to take a little while to come, but there are some significant steps underway down that road.
Wow. What school is offering that program now? Do you know?
So I'm proud to say Lincoln Memorial University is the first. Colorado State is very close. And there are several other that are looking at curriculums and funding and faculty now.
Is that a bachelor's or a master's level? What is that?
Great question. So one of the challenges, I think, with the vet tech degree, so this gets a little convoluted. Most veterinary technicians have a 2-year associate degree. There is a 4-year bachelor's vet tech degree, but in today's world, they're essentially identical in the eyes of the workplace or in credentialing bodies or state boards. They're viewed the same. So the vast majority have a 2-year degree. So building a profession, and vet techs, that is a profession. Just like veterinarians, just like your profession, it's often not looked that way, but they are. To build a truly credible profession, if the terminal degree is an associate degree, that makes it really hard to conduct research, to have the credibility. So we've got to build in to distinguish the 4-year degree from the 2-year degree. And we've got to get a master's out there. Eventually, there'll even be a PhD, but the master's level, mid-level, nurse practitioner, physician assistant equivalent in the vet side is coming. And in my mind, it's sorely needed.
That's really exciting. I think about that going back to earlier, the statistics on veterinary technicians having such high turnover rates. And part of that being due to feeling there is no way to advance. They hit a ceiling in terms of salary as well as just growth. Like part of our human potential of what makes us feel alive is to advance and grow and evolve and have new challenges. And I know that there are a certain percentage of people who aren't interested in that. They like that they just reach a level and they're comfortable. They want that level. But there's a large percentage of people who just are hungry to grow. And when they know that there's no way to advance, they're going to leave that industry and find a different path. So having this new way where you could actually, climb up the career ladder and I bet the courses are super interesting as well, like learning how to conduct research and really all the technicians, they do so much of the hands-on work too. Like they are just leading the way within the hospital.
Without a doubt. And when you look at why people stay in their jobs, and I couldn't cite exactly what they are, as we mentioned earlier, compensation is usually in the top 3 or 4, but also right up there to your point is professional development. Is my employer investing in my learning new skills? Am I growing? And I think that might be even more important with Gen Zs as we look at, again, boomers, it was 25, 30 years in the gold watch and the same employer and you ride off into the sunset. that's not the workplace today. They're constantly upskilling. They're looking to learn new things. The job place is changing. Society is changing. So we've got to be giving those opportunities, that next rung in the ladder, that next thing to learn.
Yeah. I think that would help a lot with that, the apathy that can creep in that I see when I'm in a practice where technicians are not being utilized. They kind of feel like glorified babysitters. Like, okay, I can draw some blood, I can hold for some x-rays, but really I'm here to take out the trash and, punch in, punch out. And it's so disappointing because they're happy and eager to do a lot more than that. And then when you walk into a practice where technicians are being much more fully utilized and the ratios are different, like you said, one doctor to maybe 4 or 5 or even more technicians, and those technicians are just on fire. You just see them light up. And they really appreciate the opportunity to show off their skills and build their skills.
And another quick side story. One of the things we do in our practice is we have a scholarship, essentially a tuition reimbursement program for great veterinary assistants that want to go on and become credentialed. So clearly that makes sense for a lot of reasons you and I could cite. But one of the unintended consequences is most of them are going through online courses, but part of their work has to be demonstrating hands-on clinical skills. So imagine if you're working side by side with somebody that's in that course and they're working with the doctor to demonstrate these hands-on clinical skills. What that does across the whole workforce is, wow, the doctors care, they're investing in development. I want to do that too. I want to grow. I want to learn new skills. It's just this wonderful virtual cycle that self-perpetuates.
That's really exciting. And I'm even imagining too, as that spreads across a hospital and you have these people, growing and developing and flourishing, you can handle a higher volume of patients coming through. And that's really satisfying as a veterinarian to be able to say, I was able to help more patients and not feel burned out at all because my staff was rocking and rolling. They're taking care of things. I was overseeing. It's just like this whole, it's almost like a flywheel that you can see it really speeding up, to get people in the right position.
And fundamental to that flywheel, and it's probably a different podcast than this, is just the idea that good medicine and good business go hand in hand. So often, if you're investing in your people and equipment and training and facilities, it's good for the business. If you're doing the best thing for the pets, it's good for the business. They rarely do they conflict.
Such a good point. Because I don't think that's intuitive. I think that many people think it's either business or people. If I'm all about the people, the business is going to suffer. We're going to be broke.
If I'm investing in my team members' education, I'm taking from the bottom line. No, you're not. To your point, you're helping more pets. You're working on retention. You're working on engagement. You're providing better care, more services. Pets are living longer. They're coming back more often. It's that flywheel.
Yeah. I think where I see some organizations struggle is just where to get started. If they've come from the old mentality of it's all business, people are an expense. It's like, well, okay, let's say I'm buying into this concept, but where do I even begin? I think it can feel really daunting.
Yeah.
That's a whole nother podcast. We'll save that.
It is. It's a great topic.
It is.
A soapbox I've often stood on.
Yes. All right. So let's go on to the next and. Let's keep adding.
Yeah. So the next and is the preventive care and. And while that's, again, kind of flat forehead, obvious when you think about it, it's not often discussed, or that I hear discussed, is that so much of what we do, and not just veterinary healthcare, but healthcare in general, is reactive. We're out there nobly putting out fires and dealing with sick patients that shouldn't be sick. So often these things we're dealing with could have been taken care of. And it's not necessarily a disease state. It might be something that could have been prevented with some behavior counseling or nutrition advice, immunizations, parasite prevention, brush your pet's teeth. So many things that we can do in front of things that will prevent that downstream sick visit that we're too overwhelmed to deal with if we just invest up front. And pet parents want that, particularly with the bond today. Who wants their fur baby to be sick? They don't want their fur baby to be sick. So if we move from reactive care to preventive care, it also goes a long ways towards putting a dent in the workforce shortage. It's another and that I don't hear discussed much, but I think it can be a big and as we tackle this issue.
You're really speaking to my heart right now. This is something that's huge on my mind in general. So it's something I experience as a pet parent. And the veterinarian that I go to, she actually does not know that I was a former vet technician or any of that. And what I experienced with my pets was that they were so busy that I think there was just no time for those preventative care conversations. It's more like, okay, here for wellness check. which vaccines do you need? Which reschedule your dental? What blood work do we need? Get you in, get you out. And then great communication in terms of what the lab work said, or, if there was a problem, the reactive, conversations were very helpful. But when it came to preventative, there just didn't seem to be time for it. And I think this also occurs. One of my fantasies in vet med is to have initial visits always include talks about death. I would love for the entire team to have a very high degree of comfort with the fact that probably every pet you will have will die. Maybe your tortoise will outlive you, maybe your parrot, but otherwise it's highly likely that your companion is going to die before you. And we should already be discussing, these things should be talked about. I think that it feels to me almost like we don't talk about the elephants in the room, like preventative care, the fact that we're going to deal with an animal that will likely get sick and die during the period of time that you have it. Because we come in with like a new puppy or kitten so full of excitement and thinking there's never going to be a problem. They're going to just be cute forever. They're biological beings, though. That's not how nature works. But it's super afraid to talk about it.
You're singing my song again. Back to the challenge of offering preventive care. So from the perspective of the veterinarian, given today's model, so I've got 20 minutes with you. The books are full, and you're coming in likely because your kitty's itchy or your dog's shaking its head. So I need to address the presenting complaint. So let's talk about that ear infection and what we're going to do and how we're going to deal with it. And the clock is ticking, and you've got to go. You've got things to go. But before you leave, Crystal, let's quick talk about nutrition, behavior, immunization, parasites, and dental care. Your brain's full. You're dealing with the itchy kitty or the dog that's shaking its head. My clock's ticking. I got to get to the next room, which brings us back to some of these ands. If I'm delivering this in a team-based manner and my team's delivering this, if I'm embracing technology, maybe I send you a video, maybe I get you some clips on the way out. Your brain's overwhelmed with the presenting complaint. My clock is full. So we've got to look at a new way of delivering this. And further, as you were talking about death, the other end of that, wouldn't it be great if at the start of every relationship with the pet, that the veterinarian sat down with you and said, "Congratulations, Crystal, for getting your new kitty. Did you know that you and your family are going to be healthier because of this? Mm-hmm. That your children are going to learn empathy, that by walking your dog every day, that you're going to be in better shape, that your blood pressure will be low." All of these things that we get as veterinary healthcare professionals, I don't think our clients, they get it at some level, but not at an intellectual level. And if we point that out, how smart they are to have got that pet, just because of puppy breath and kitten purrs, but because of what that does for their health and the health of their family, I think that's huge. But again, we've got so little time. We've got to find a better way of delivering all of this.
I think you make such a good point. And that's where coming back to the technology could be so helpful. I for sure would be very motivated if there were just a series, like a puppy pack and a kitten pack. And then maybe, people that adopt older animals, like I adopted a hospice cat. You could have different kind of little modules you could just go through. And it'd be so interesting. Like, I think a lot of people are daunted by the idea of brushing your pet's teeth. Like, they're not going to like that. So how am I supposed to do it? And all these things would be so helpful to talk about. And I also have noticed that, we all have our different strengths. And I can imagine there may be like a technician on the team who loves end of life and euthanasia. And there's another one who loves, preventative care. And there's another one that loves, the acute issues. And they could kind of be the go-to specialists that could do the follow-up and email out the videos and make sure that you watched them. And do you have any questions? Because another challenge, I think, in vet med is the follow-through, that many people have a great initial appointment, but then it's kind of like, bye, and we expect you to follow up and the ball, you're taking the ball, it's in your court. And, they get distracted, they're busy, they have kids, and they forget. Then they come back in 6 months like, oh, shoot, I don't remember that. So if we had that technology aspect, I think we could just make so much more connection.
And the team base that, as you point out, you've got one team member that's your nutrition counselor. You've got one that's all about behavior. So and that grows their careers. They're empowered. They're adding value. They feel good. Mm-hmm. You're providing. Again, we're back to this virtual flywheel, and many practices are there or getting there. This isn't pie in the sky stuff. This is happening every day, not always perfectly, but we're getting there.
Ooh, I hope the people listening too I feel the enthusiasm building, like these kind of conversations. This is the point. Like, we talk about ideas and you can see that there's just so much potential here. It's
Yes.
impossible not to solve this issue. We are definitely going to solve it. It's just a matter of which ingredients are we going to mix together and what combination to move things ahead. So I think we're coming down the home stretch with our final and.
We are. So we've done well-being, and we need more vets and vet techs and technology and team-based healthcare and preventive care. And the last piece we'll talk about is kind of the innovation piece, the new models that are out there, filling some of the gaps. And these, I think, have largely been accelerated by COVID. So things, again, as obvious as urgent care that we've seen in human medicine forever has really come to light since COVID. There are urgent care practices popping up all over. If you can't get in to the emergency, or maybe their pet's condition doesn't really rise to the level of an emergency practice, go to the urgent care. It lowers the barriers to care, more availability, lower price, another career path for veterinary professionals. Similarly, dental practices. We've got practices that are just doing dental. We're seeing some really cool models around vet tech delivery, where vet techs are delivering well care with a veterinarian maybe on site or maybe in some states virtually. We're seeing technology. We're seeing a number of practices that are built around technology platforms and subscriptions that are doing some of the connections. So there's lots of cool things that are coming that are breaking down barriers to care, helping more pets get more care, providing more careers, and helping towards this issue with the workforce.
I had a guest on several episodes ago. She was a registered veterinary technician. I think maybe Montana. I might have that wrong. But she was essentially providing technical services within the scope of her practice. And they'd be signed off on by a veterinarian. So the veterinarian would say, I want you to administer these medications, X, Y, Z. And in a very remote rural area where, it's a lot of land to cover, she would just jump in her pickup truck and she goes out to different locations. And it's been very helpful for clients to have this person that can come out and help with like a nail trim or deworming an animal, these things that for a veterinarian, it's like, man, I'm already so booked up for me to come out and do something like that my technician who's so skilled at could take care of. And for her, it's this side business. It's becoming a full-time business.
Right.
She feels independent. She's getting to work with multiple veterinarians, multiple clients, making her own schedule. And it was an answer for her to almost leaving veterinary medicine. I was like, this is amazing. And I love that. And it's so inspiring for other technicians to hear you may not have to leave. You might just need to think about it, be a little more innovative, because some people are really individualistic and rugged and they do better being their own boss. Some people are really team-oriented and they love being a part of the cohesive group. So kind of figuring out where do you fit into this huge pie chart of possibilities. There's research if you want to be alone, kind of get nerdy and dig in deep. Like, there are really many different ways to be a part of it. And I think these models that you're describing give people kind of hope that they might find their path and ways they fit in.
Yeah, I think as a profession, we've got to be open to these. And as we talked about with innovation earlier, not everything will work, but let's try them. Similar story to the one you're relating from Montana. A friend of mine, Dr. Katie Cutter, has started a new practice in Seattle called Booster Pet. If you've not interviewed Katie, she'd be fascinating.
Oh, yes.
But there in the state of Washington, the Practice Act reads indirect supervision, where some practice acts read direct. So what that means is a vet tech with indirect supervision can do a number of things versus actually having a veterinarian on site. So indirect could be virtually. So she has a number of practices that are run by vet techs. And the vet tech takes you in, takes care of the pet, and then brings in the doctor virtually. So the doctor is on the screen validating what the vet tech came up with. But to your point, empowering vet techs, helping more pets, raising compensation and satisfaction in the workplace amongst vet techs, it's a brilliant model. And we'll see more and more of that. And they won't all work, and we will stub our toe here and there. But we've got to get out there and innovate and try new models. The old model has served us well for decades, but it's breaking down.
It is. I love Booster Pet. I remember when I met her, it was like two peas in a pod. Just very exciting conversation. I'm sure she'll be on in the future. And I also really appreciate how we're able to look to other industries, like even beyond human med, just industries in general, to say what's working out there. There's so much happening and things are evolving so quickly, especially with technology being added. It's kind of the wild, wild west in some ways, but I can tell that you have that innovative spirit. You're willing to fail, to try things, and something's not going to work, but you learn from it. And then you can just keep pivoting until we find something that really does fit. Yeah.
Without a doubt. So those were the ands. We've got to do them all. We've got to be open to change.
Yes, I absolutely love this message. I think the people listening today will be nodding their heads and hopefully feeling inspired by the different ideas here and where they may be able to contribute, how they could leverage some of these at their own clinic. And I'm wondering if you have, for those people listening today, ranging from owners, practice managers, technicians, doctors, any core takeaways you really want people to leave here today with?
Yeah. And thanks for giving me a heads up on this question. I was thinking about this all morning. So I have kind of three takeaways. So one is let's celebrate what's right with the profession. I mean, the veterinary professional's role in society and in taking care of pets and families has never been bigger. And this day of polarization, left and right, red and blue, black and white, whatever it might be, we all agree on pets. There's just nothing more unifying. So our role and the high esteem we're held by society has never been more important. So celebrate what's right. Number two, as we mentioned before, is take care of yourself first. So take care of yourself, then you can take care of those around you, your team, and then pets and families. And the last would be, and we've kind of mentioned it with the ands, is be open to new things. There's so many cool things out there. Be thinking about telemedicine, about veterinary nurse practitioners, about new models of care, about team-based care, about new schools. So many great things going on out there. You don't have to jump into them, but at least be open to them. Listen, get both sides, weigh in. And if you are intrigued, there's never been a better time to be a veterinary professional. There are so many cool things going on. We are suffering through a workforce shortage, but again, that's a problem of abundance, and we can deal with it. We are dealing with it.
We are dealing with it. Those are such wonderful takeaways. And I want to piggyback and say, in the spirit of gratitude and appreciation, how much I love being a part of veterinary medicine. And I think that we're also privileged to be able to do this work. It's very unique. And the people that are drawn to veterinary medicine, again, with that great degree of empathy and compassion, I feel like it's a huge privilege. And also on a daily basis to get to be around animals. That's very special. I think many people envy that and wish that they could have that opportunity. And then the excitement of medicine that's always evolving and changing and the things that we're able to do to make a huge difference on the well-being of pets. It's a very exciting time. And, to piggyback on you saying, take care of yourself first. Again, you all have permission. It's okay. You are allowed. We will not judge you. This is a new era. But it's actually, that's the path of confidence and strength, is to say, you know what, I'm going to stand up and take care of myself. I just want to give everybody permission to do that. I can't say it enough. I think it's really, really important. And I'd also like to leave off today. Oh, go ahead.
Well, I was just going to say, and we're fortunate to have folks like yourselves coming into the profession to help us understand that message. There's never been a better time to be a veterinary professional, and we all should feel that way. Maybe not every day when you get out of bed, but most days.
It's true. I think too, most of us have some story where we've gone through the difficult times, and sometimes we have to learn the hard way. We have to learn by getting exhausted and burned out and recovering from it, and then having that wisdom to know what our red flags are, what drags us down, and how do we bounce back from that, and then how do we support each other in doing so. And I really like the optimism that you bring to this. So for a person who's been in the veterinary profession for many years, and you've seen all different aspects from academia all the way through corporate practice, I think that your perspective is really grounded and solid and helpful. And the optimism is really contagious. I appreciate that you bring that to the conversation today.
Well, thank you. I've enjoyed speaking with you.
Yes. And how can people find you? If they want to contact you, maybe they have questions.
Yeah, I'm always happy to connect with colleagues. So they can reach me through my email, which is bob.lesterdvm@wellhaven.com. They can find me on LinkedIn. Or if they want to learn more about our practice, which is really based on a lot of what you and I discussed today, Crystal. In fact, it's in our name, Wellhaven, a safe place. They can look at our Wellhaven website.
I want to encourage everybody to check this website out. I really like how you break down the different aspects of well. And I think that the story is very inspiring, and that it will attract people to think, again, it speaks to a new model, right? How do we do things differently? So I'm going to put all of that in the show notes. Many things we talked about today, I will make sure to link up so you don't have to hunt for them. And Dr. Bob, I really appreciate you spending time with us today and being here.
Well, thank you. It's been fun.
Thank you for joining me today. I hope that you feel stoked after listening to this episode. And as always, I would love to hear your comments and feedback. Is there a topic that you want to know more about? Please let me know. And thank you again for subscribing and sharing your favorite episodes with others. It really means a lot.